Meg, joining us now to discuss the interest in berberine is Dr. Jane Morgan. She's the Executive Director of Health and Community Education at Piedmont Healthcare and Adjunct Associate Professor of Medicine at the Morehouse School of Medicine. Doctor, thank you for joining us on The Why. And social media is so influential, and people are documenting what they're claiming as an effective supplement here. So what is your advice to those considering berberine?
Thanks for having me, Lauren. When we take a look at berberine, it certainly can be found in, a lot of products, golden seal and gold thread and Chinese grapes. But we have to take a look from a medical perspective with regard to whether these are being tracked, whether there's data, whether there's FDA approval. So far, the data on this is scant. The data that we have is really animal data, mouse data. We don't really have human data on it. And there are a number of claims, as we know, to boost your immune system, to improve cardiac health, to challenge your gut microbiome, to lower your glucose and control your blood sugar, as well as control your weight, even antibacterial, antiviral, anti aging. So, all of this has to be taken a look at, and buyer beware. Different supplements can have different types of ingredients in them. So the purity can be different depending on the brand and the source. None of this is regulated, so you're out there in the wild, wild west.
Yeah, I mean, it's interesting that you bring up that you never know what you're going to get because some medical experts claim that 1.5 grams, very specifically, and under can provide these minimal negative effects to organs like the liver and kidneys. That's what we're hearing. Would you agree with that, or is it hard to even discern that because everything's so different?
I would agree that we don't know exactly what the side effects will be, and certainly not the long term side effects. We've seen in mouse models that there have been side effects, especially with GI and the kidney. Whether that translates to humans, we don't know. So, the good and the bad, it's unclear whether it would be transferable.
You got to round out those followers on TikTok. Make sure you're getting all the information you can. Quick question here. When you talk about taking caution when it comes to this because it's not FDA regulated, do we know
Mhm.
if taking this in addition to other medications, if there's risks with that of mixing?
Oh my gosh, such a good point, Lauren. We absolutely would not know drug interactions, these drug to drug interactions. And if you have chronic medical conditions, so for instance, I am a cardiologist. If you have a heart condition, you are likely to be on multiple medications. Make certain you disclose if you're taking berberine and any supplement to your cardiologist, such
Mm.
that those interactions can be tracked and recommendations can be made based on your entire compendium of what you're actually ingesting into your body. Even though this is plant based, it does have some active metabolites.
Dr. Jane Morgan, thank you so much for your insight. It's a pleasure.
Thank you.